Ever take the fetuses out of the containers and study them, or has that already been done?
In hospital, each year we have about 250 cases of malformations.
Malformations, 250
Yes,
in the hospital a year?
Yeah, several cases, several kinds of congenital malformations.
Okay.
And Siamese twin, left blind, hair lips, no arm, no legs.
And how much of this, again, do you think is created by the Agent Orange? How much of these deformations was a result of Agent Orange and the toxins?
And until now, very difficult to conclude that all of the malformations are from vaccine effect. One part of the malformation can cause from vaccine. I think that because in the spray area and the not spray area, the rate in the spray area is much higher. And so we think that there is one relation between two groups, two areas.
Is that the tour? Have we seen everything we're supposed to see?
There is a... Em nói cái gì ạ? Thôi chỗ này nó lung tung lắm, không phải bây giờ có bệnh nhân. We have the patients now, hydatidiform and choriocarcinoma. Most of them are very young. If you want, we go to...
I think I would rather not intrude on their privacy. I think we've, seen basically what we came to see. And I think it'd probably be better just to let them.
If you want to see some patients, and you can ask them if you want. The patients in the spray area come here for treatment.
They do?
The other side.
Where are they? How far away?
Yes. Yeah.
Okay. Now, what wing of the hospital is this? What's this called, this area?
This hospital here.
No, this wing.
Department of Gynecological Diseases. Gynecological Diseases. Mấy em ơi, chị
How old are the patients that are here?
The patients, 60 beds. 60 beds for the patients of hydatidiform and choriocarcinoma.
But how old are they? What's their age?
How old? Some of them age women, but the most of them are very young. Em giới thiệu vài em nói đi.
Em đi.
Doctor, how are you? Nice to see you.
She is the medicine president of this service. You can present some patients.
Are we sure that it's all right to? I don't want to intrude on their
These all
lives.
patients are of mole or choriocarcinoma. You can have it statistics.
All the patient here is hydatidiform and choriocarcinoma.
How many?
You can see in this the metastasis of the choriocarcinoma, a sort of cancer of lungs. Metastasis is metastasis.
22 years old only.
You can see the choriocarcinoma, a sort of cancer of uterus.
Will you operate on this young lady here?
Yes. You can operate this case. You can operate this case. Or treat with methotrexate.
So So it's too late to operate.
Yes.
22 years old. But choriocarcinoma.
What do you have here? 1, 2, 3, 4, 5, 6,
Yeah.
7, 8, 9, 10, 11, 12, 13, 14 beds.
Yeah.
14
3 rooms.
beds. 3 rooms.
Còn riêng phòng khác không con? Yeah, 24 years old.
This young lady over here.
Mình nói được hết. Nói đi. Anh chị.
25 years old. Can see.
Choriocarcinoma.
Carcinoma.
Uterus.
Mm.
In uterus.
In the uterus. This is all women here.
Dạ.
Fine.
Mày có con chưa? Dạ. Có con chưa?
Mình chưa có sanh.
Học nghe đi.
24 old.
24 years old. Does the heat bother people here? Hot?
Hả?
Does the heat bother the patients much? It's warm in here.
This is the origin of Long An provinces.
Ah.
Here it is here.
Mm-hmm.
29 years old.
25 years old? Yes.
Choriocarcinoma.
Có con chưa? No child. One child only. One child. Em có hysterectomy nào không? Có hysterectomy nào?
Hysterectomy.
No.
I don't want to interrupt their lives any more than we have. I think we've seen enough.
We take off the uterus to prevent and to save her life. Because if we stay the uterus, we can metastasis to the lung and sometimes to the brain and cannot survive.
Okay.
But the most of them come from the spray area.
From the way area?
Spray area. Spray area.
Spray area. Where the Agent Orange was sprayed.
Yes,
Most of them do? But you still haven't been able to prove that that's caused it, have you?
If we have the good condition, we can make the analysis of level of dioxin in the spray area and compare in the non-spray area, non-spray area, and we compare. Suddenly, we found out that so
Are these,
patients,
is it?
750 beds, but always 800 patients. And so sometimes we have two patients in one bed.
2 patients in 1 bed?
Yes, sometimes.
How often?
For the 750 beds, but always over 800 patients. And so.
Now, what is this area of the hospital? What do you do here?
After operation.
After operation? This is the operating room in here?
Yes.
This is preparation here? The doctors?
Doctor đang mổ gì đấy? Đang mổ gì đấy? Hả?
It's operating now?
Yes.
What kind of an operation is it?
U sơ tử cung là gì? Fibrom of the uterus. Fibrom of uterus. Cắt uterus. Fibrom.
In this operating room, we had operated the Việt and Đức Siamese twin here.
Here.
In this.
Okay. Is there another operation going on over here?
And this mole. Mole.
Mole?
Mole. Molar. Choriocarcinoma.
Choriocarcinoma.
You can perfect
Take off the
uterus or choriocarcinoma.
How long?
We
How long?
cannot keep the uterus for the women, and so we can take off.
How long does this operation take?
bao nhiêu lâu?
1 year. One hours. 1 hour.
1 hour.
Where is most of your equipment from? Where's it made?
Equipment.
What brand names do you use there in the equipment in the operating equipment?
I don't know.
Is it from France? Is it from Germany?
It's all the country.
All over
It's donated by all
International
the international.
material.
Donated by the country.
Japan, France,
Germany. It's
Germany,
donated by the
some from America.
Some from the United States?
But very,
United States.
very old.
Old equipment?
Before
You can see it's very
1970.
old equipment.
But since 1975, there haven't been any.
Yeah, before,
Before
1975.
20 years.
At that time, after 1975, we not receive intensive care, 24-hour.
Care. Was this emergency room?
After operation, yeah, and stay here 24 hours, and after.
It's been a very good tour. Thank you. Dr. Arnold Schechter, one of the things that I noticed when I talked with those folks is that they all said, I think most of them said that they originally were from Hanoi and had moved down to this hospital in Ho Chi Minh City in the south. Are they members of the party?
Well, what you observed was that it's considered highly desirable to work in the South and in Saigon City. It's a plum assignment, so it's sought after. In that hospital, many of the doctors and nurses are from the South, but some of the doctors and nurses from Hanoi very much want to go to that outstanding hospital.
Admiral Zumwalt, what's your reaction from seeing this tape? Have you been to the hospital, by the way?
I have not been to the hospital. I haven't been to Vietnam since about 1974. But the interesting thing to me is the fact that although we can't prove it statistically yet in Vietnam, the malformations that you see there are typical of some of the results that we've seen in children of Vietnam veterans in this country. And there's no doubt in my mind that some fraction of those specimens are the result of exposure to Agent Orange on the part of the parents.
Before we go back to Dr. Schechter for some of the medical questions, let me ask you a political question. Do you feel that Americans have any responsibility in Vietnam for the effects of Agent Orange?
Well, I think that our tradition has always been that we seek to help former enemies, as we did in Japan and Germany after World War II. The issue with regard to Vietnam is that the people who are affected by those diseases of the result of exposure are, just as our boys were, innocent people who were caught up in a war foisted upon them by their communist leadership. And I think in the tradition of America, binding up the wounds, that we should work with them, and there are some significant benefits to be gained for us through the kind of medical research that Dr. Schechter and others are doing by dealing with this very fine laboratory example of what happens to humans exposed to dioxin.
Our audience should know, if you've just joined us maybe in the middle, we did start off with a conversation with our two guests. That Admiral Zumwalt was Chief of Naval Operations back in the early 70s. I think you write a column today, don't you? For a newspaper
Yes.
column? Among other things?
Yeah, among other things.
And he was also stationed in Vietnam in the late 60s, where he ran the, would you call it the Brown River Navy? Or?
Brown Water Navy, yes.
Brown Water Navy, excuse me. And as he told us earlier, has lost a son who fought in Vietnam to Agent Orange, or to cancer that you suspect was a result of Agent Orange.
That's correct.
What year was your son there?
He was there at the same time I was, from 1969 to 1970. Came down with his cancer, actually 13 years later. He was one of the early ones on the curve. It's a little early. The average period is after 20 years of exposure.